So just to start with looking at the stages of involving the public in your research. So there's participation, which is the data collection from research subjects. We then move on to engagement, which is the public outreach activities that you may be undergoing, and then we move to, there's dissemination as well, will fall under that engagement. And then we move one step further and we're talking about involvement. And this is what we're focusing on today. This is where the public, they're actually having an impact on the research questions that you're asking, and they're also having an impact on how you're conducting your research. So to start with a definition of PPI, the definition that we use is the Involve UK definition. We're talking about research that's carried out with or by members of the public rather than to, about, or for them. When we talk about the public, we're talking about everyone who has an interest in health and social care as a public service. When we're talking about patients, we're talking about people who are using the services, such as the patients themselves, but we're also talking about clients or their carers and service users. And then we talk about involvement. We're talking about the active involvement between those people using the services, carers, the general public, and researchers. So I wanted to take a little bit of time to look at more closely at involvement versus participation. It is something that we see researchers who are less experienced with PPI, that can cause a little bit of confusion. So when we talk about involvement, we're research outlined with or by the public. With participation, it's research on or about or for the public. With involvement, as I said, it's an active partnership with the researcher. The public is providing input and opinions. They're involved in decision making. So that's key, that involvement with decision making. And then when we talk about participation, we're talking about the public being research subjects in a study and perhaps providing their samples or their data. With involvement, the public can actually carry out the research, whereas with participation, the research is going to be carried out on the public. And then when we talk about involvement in terms of dissemination, the public can help share the findings, the research findings. And when we talk about participation, we're saying the research findings, they can sometimes be shared with the public, but that may not always be the case. So why should the public be involved in research? Well, we're all either current or potential users of the healthcare services. So any research that's carried out, it's going to impact us at some stage. Members of the public, they're going to provide a different way at looking at things. They're going to be guided by their lived experiences, their practical experience. So they're going to help ensure that the research is in the best interest of patients, carers, healthcare service users, and the public. When research is designed with the help of patients and families and communities, what emerges is a different set of questions and priorities is going to emerge, and hence you're going to get different results. So is there any evidence base for PPI making a difference? Well, the evidence base is just beginning to grow, so it is really important that we collect data around this. There has been a recent systematic review was published which looked at 26 clinical trials. What they found was when there was a PPI intervention in clinical trials, it did increase the number of patients recruited to the trial. And the authors suggested that the findings could mean that if you had a hypothetical sample of 1,000 patients, you might typically get 100 patients enrolling in a clinical trial. But with a PPI intervention, this could increase from anywhere between 1 and 30 patients enrolling. So some very positive results there coming out in terms of recruitment to clinical trials. So now I want to take a look at PPI in the research cycle and where you can bring PPI into your research. And you can bring it into every stage of the research cycle. Right there at the top, at the very beginning, it's when you're identifying and prioritizing your research questions. Service users, carers, members of the public, they can help inform those research priorities. And then when you move on to actually designing the research, they can help clarify the research question. It may actually be a co-design project where you're bringing your PPI team member along at every step of the way. A PPI team member, they can ensure the methodology is suitable. They can assist with your recruitment strategy. And then when you move on to undertaking and the actual management of your project, they can assist in collecting data and carrying out interviews. They may also sit on a project steering group or a governance group. And then we move on to actually analysing and interpreting the data that we have. Well, PPI team members, they can actually work with your research team to interpret the data and actually look at how teams are developing. And then we move on again to dissemination. A PPI team member, they can share the knowledge how best to share the findings, I guess. They could actually present the findings, which could be very impactful. And they can help to write up the dissemination material, making sure that it's, understandable, easily accessible, and so on. And then when it even comes to actually implementing your research and getting it translated out there, they can actually assist if it was, a new service you were introducing. They could assist in the actual training. Your PPI team members, they may already be linked in with knowledge users and policymakers through local groups. So they may be that link, help that with that link to get your research out there. So as I said, every stage of the research cycle, you can involve PPI team members. So now I want to take a look at PPI in your grant applications. So where can you bring in PPI team members into your applications? There may be an opportunity to have a lead PPI applicant. A PPI team member could be a co-applicant or collaborator, depending on the size of their role. As I said, they could sit on advisory groups or steering groups. In your grant applications, it's very important that you clearly describe what the role of each PPI team member is, to show that you've really thought about this, and then also for the actual PPI team member, for them to be very clear on what their role is. That's up front is very important. You may be asked what PPI you've done to date and how has this changed how you plan your research, and then you could be asked about what PPI you will do for this project. I did want to touch on the budget. It's very important where you are including PPI in your research proposal that it's reflected in the budget. You need to think about PPI team members' time. They should be compensated for their time, and just things should be made as easy as possible for them. I also wanted to mention that, PPI, it may not be feasible or appropriate for the work that you're doing or for all studies. And in this case, I think it's important to show in your grant applications that this is something that you have thought about, and put a case forward why you think in this particular proposal it's not suited. So I just want to talk a little bit about public review of grant applications. More and more you will notice that funding bodies may be sending out your grants to public reviewers and not only the traditional scientific reviewers. So the role of a public reviewer, it generally is to look at your application and give their opinion on whether or not they think that you have involved the public and patients or carers sufficiently in your research. They will be asked in particular to look at your lay summary. Is it easy to read, easier to understand? They'll probably be asked to look at the relevance of the research question and how you came about that research question. They will be asked to look at the PPI involvement throughout the whole study, and they will also be asked to look at the research design, and then your plans for impact of the research and the dissemination of the research, and are you bringing PPI into those? So I'm just going to finish with a list of some useful resources that should help to get you started bringing PPI into your research. I have the Public Involvement Impact Assessment Framework that will provide tools for successful involvement of members of the public in your research. And there's a couple of links there to the Involve UK website. Just to note, their website, it's invo.org.uk, but it's certainly worth going on to there. I'll just hand you back to Elisa, and just thank you very much for listening.
Thank you so much, Aoife. That was a really great overview of PPI. So now we'll move on to Bláthín and Keighron, and they will talk to us about how they put PPI in action on their research project.
Brilliant. Thank you very much, Aoife and Alicia. I think our presentations complement each other very well, so thank you for the introduction on what PPI is and from a funder's perspective. And we're going to present on our project, D1 Now, which is funded by the HRB, and I've Keighron with me as well, who's a member on our PPI panel, who's going to give his perspectives as a PPI member on D1 Now. So the outline of this presentation, I just want to give you a background to our study, because I think it'll help with telling the story. So the background of D1 Now. I'm then going to introduce our PPI panel, which we call our YAP, or Young Adult Panel, and tell you a little bit about our current members and recruitment now going on 5 years when the app was developed to now, and how we recruited and still are recruiting. Then I'm going to hand over to Keighron, who's going to discuss from a YAP member's perspective his impact and involvement in D1 Now, our study. And he's also going to finish having been an original YAP member, so he's with us 5 years, and reflect on 5 years on, maybe 5 years more. Keighron can give his own reflection on that. He's laughing here beside me, but he's going to finish with his own reflection. So just a bit of a background. So D1 Now is focused on improving outcomes for young adults with type 1 diabetes. So young adults age 18 to 25. And as we all know, whether you're a young adult now or were a young adult, there's lots going on at that time of your life, whether that be college, relationships, alcohol, family, and so on. Lots of stuff going on, never to mind living with type 1 diabetes, which requires intensive self-management. So this picture that you see here on the screen really summarizes that quite well for young adults living with type 1 and just how difficult a time it can be. And when we talk about type 1 diabetes, what you're looking to gain is optimal glycemic control or sugar control. And all I want you to look at in these two figures is what you don't want to see is the light grey bar to be high, so that's poor glycemic control. So ideally you want to see that black bar being the highest and not the light grey bar. So I hope you're all with me. And if we look in the second figure, you can see Ireland is the 1, 2, 3, the fourth in there in the second figure. And we can see that light grey bar is significantly higher than the black bar. That suggests that young adults with type 1 diabetes have poor glycemic or sugar control and struggling with their type 1 diabetes, and definitely a need for intervention. And our own study group here, and I should mention that this work is led by Professor Sean Deneen, who's a consultant endocrinologist and works here in NUI Galway in Ireland, leading out on this work. They've published a systematic review that looked to see what interventions have been done to improve outcomes among young adults with type 1 diabetes. And of no surprise, a similar conclusion to most systematic reviews, we found that interventions were inconclusive and non-improving outcomes in the long term for young adults with type 1, and a definite need for intervention and intervention development. Perfect. And what is D1 Now? And so I'll talk about that in a second, but before I do that, as it was being developed, you can see PPI definitely has a strong PPI involvement, which Keighron will outline later. Lots of stakeholder opinions, and it's theory-based. So we're based in the Health Behaviour Change Research Group in the School of Psychology here in Galway, and following very systematic theoretical approach using the Behaviour Change Wheel and COM-B approach, which was developed in UCL in London by Susan Mickey and colleagues. And the intervention, very quickly, had 3 components, and all of the 3 components aim to improve engagement for young adults in the diabetes service, improve attendance. Those were some of the things that young adults would say they're struggling with in terms of engagement with the current service, and something that D1 Now looks to change. So we've got 3 components that make up D1 Now. The first is a support worker. This is actually really exciting. So it's a new person that will be joining the existing diabetes team. And our PPI panel, the YAP, will be a big driver behind this component as well, and moulding what this support worker will be like. But they're going to be dropped into an existing clinic and aiming to improve engagement, attendance, and outcomes among young adults with type 1, supported by 2 other intervention components. So an agenda setting tool that will be used in clinic, so a very simple back-to-back tool that asks young adults what they would like to talk about in their clinic appointment today, and explores things. If you imagine that diagram that I showed you of that head and all the things that happens in a young adult's life, so that tool explores those other things, so relationship, life, college, and so on, so not just focusing on the diabetes. And the final component is Florence, so it's a text messaging app. And that sends the young adult daily reminders if they want them. It can be completely individualized, and the support worker will set that up. But it has a text message interface, and the young adult will receive messages on maybe checking their blood sugars, or perhaps and this is where the app have been really involved, and Keighron will talk about this in a little bit. But they said, what about a message on an alcohol safety reminder? So college students might go out maybe on a Thursday night. So what about a text message from Florence that evening to say, if you're going out tonight, to make sure to be safe and check your sugars in the morning, and so on. But that is D1 now.